Welcome to This Explainer. If you're tuning in today, you're probably at a huge, pivotal moment in your life. You're considering building your family through assisted reproductive technology. And honestly, it can feel incredibly overwhelming. I want to acknowledge that right out of the gate. But today, we're going to walk through exactly what exploring IVF at ART Fertility Clinics in the UAE really looks like. We're going to break down the science, the timeline, the big medical words, all into a really clear, supportive guide. So take a deep breath, get comfortable, and let's explore this together.
Actually, let's kick things off with a quote straight from the clinic's guide. So often, just the thought of fertility treatments carries this heavy emotional weight, right? There's stress, there's anxiety, but I want to gently shift our perspective for a minute. Yes, it's a medical process, but as the clinic notes, embarking on IVF can be a very exciting journey. It's a proactive, incredibly hopeful step toward your dream of parenthood, and it's backed by some truly mind-blowing science.
To keep this whole process as stress-free as possible, here is our roadmap for today. First, welcome to your IVF journey. Second, preparing for your treatment. Third, the step-by-step IVF process. And finally, fourth, answering your biggest questions. Because knowing exactly what comes next is honestly the absolute best way to ease your anxiety.
Okay, let's dive right into Section 1. Welcome to your IVF journey. Before we get into all the logistics, we need to make sure we're on the same page about what IVF actually is. Let's drop the medical jargon for a second. IVF stands for in vitro fertilization. In vitro simply means outside the body, specifically in a highly controlled, incredibly advanced laboratory. Fertilization just refers to conception, right? The joining of a woman's egg and a man's sperm. So rather than hoping this happens internally, the clinic uses cutting-edge tech to facilitate that crucial first spark of life in a specialized lab dish. It significantly boosts the chances of a successful conception.
Now you might be wondering, is this the right path for my specific situation? Well, IVF is recommended for a whole bunch of reasons. It could be for male factor infertility, like low sperm count. For women, it could be related to polycystic ovarian syndrome, endometriosis, or tubal disease. Very often, it's simply used for unexplained infertility, when a couple just hasn't been able to conceive after years of trying and doctors can't quite pinpoint why. It's also an amazing tool for pre-implantation genetic diagnosis, or PGD, to avoid passing on an inherited genetic disorder, and for preserving your fertility before something like cancer treatment. Whatever your reason is for being here, the most important thing to know is that you are definitely not alone.
Moving right along to Section 2, preparing for your treatment. Before any active treatments or medications even start, your doctors need to get a really good look at your unique biology. Think of this as building a custom blueprint. Before initiating your cycle, the clinic relies on 4 specific preliminary screenings. They'll do ovarian reserve testing to check egg quality and a semen analysis for the male partner. They'll also run a standard infectious disease screening, just to ensure safety across the board. And finally, a pelvic ultrasound. Your doctor pieces all this specific data together to build a treatment plan that is 100% personalized to you.
All right, Section 3, the step-by-step IVF process. This is where people usually feel the most nervous, mostly just because it involves medical procedures. So let's completely demystify it and walk through exactly what happens step by step.
Now, what's really interesting, and honestly super reassuring about this, is how structured and clear-cut the clinical phases actually are. It isn't some never-ending cycle of unknowns. It literally comes down to 4 distinct steps: ovarian stimulation, follicular puncture, fertilization and culture, and finally embryo transfer. Let's break those down. Step 1 is ovarian stimulation. In a normal, natural monthly cycle, your ovaries produce just 1 egg. But with an IVF cycle, we want to gently encourage your body to produce a few more eggs, which really increases your chances of success. To do this, you'll take daily medication injections to safely promote the growth of multiple follicles. And don't worry, you'll be popping into the clinic for routine ultrasounds so your doctor can carefully monitor that growth until they're the absolute perfect size. Once those follicles are ready to go, you're going to hear a term called the trigger shot. This is absolutely crucial. It's a very precise hormonal injection, usually HCG, that induces the final maturation of the eggs. And listen, the timing here is literally everything. It has to be taken exactly 34 to 36 hours before your scheduled egg retrieval. The exact date and time of the very next step depend entirely on this single injection. Real quick, as you move into Step 2, your medical team is going to use the word oocyte quite a bit. Let's demystify that so you're never caught off guard in the clinic.
An oocyte is literally just the medical term for a human egg. That's it. So whenever you hear them say oocyte retrieval, they just mean egg retrieval.
Which brings us right into step 2, follicular puncture. This is the big day you've been prepping for, and I really want to reassure you here. This is a guided, super comfortable day procedure. The doctor gently collects the eggs transvaginally under the guidance of the latest ultrasound tech. And most importantly, you'll be given local or sometimes general anesthesia. You are going to be entirely comfortable the whole time.
While you're kicking back and recovering from that, the clinic's embryologists immediately dive into step 3, fertilization and culture. The prepared sperm and the retrieved eggs are placed together in culture dishes to fertilize. And this is where ART Fertility Clinics technology provides incredible peace of mind. They use a system called RI Witness to absolutely guarantee that sperm and eggs are correctly matched. Zero room for error. Plus, their specialized incubators are continuously monitored by a system called Iltrix, ensuring a flawlessly safe environment for your developing embryos.
And that leads us to the final clinical step, the embryo transfer. After checking on your embryos every day, your doctor and embryologist will pick the absolute best day for the transfer. And here's the best news. This is a simple, completely painless procedure. They use a soft, flexible catheter under ultrasound guidance, and it requires absolutely no sedation or anesthesia. Once the embryo is safely placed into the uterus, you can literally just go about your day. Believe it or not, bed rest is actually not advised.
Okay, so we've walked through the clinical science. Let's wrap things up with section 4, answering your biggest questions. We're going to do some rapid-fire reassurance here, tackling the practical, day-to-day things patients worry about the most.
First up, the big one. This is undoubtedly the most common logistical worry. Hearing that you have to give yourself injections at home sounds incredibly intimidating, right? So how many are we really talking about here?
The reality is way more manageable than most people fear. You're looking at a totally finite, temporary window. Most women just take 1 to 2 daily injections for a short span of about 8 to 12 days, followed by that one final trigger shot. In total, it's usually around 15 to 25 injections for the whole cycle. Yes, it's a concentrated effort, but it is over before you know it.
Question number 2. Will the IVF treatment make me feel tired? A lot of patients worry about the physical toll this will take on their jobs and daily routines.
The honest answer? Yeah, for sure. You likely will feel tired. But you have to reframe how you think about that fatigue. It is a completely normal and honestly, really positive sign that your body is doing exactly what it's supposed to be doing. Growing multiple follicles takes a lot of energy, and combined with those hormonal shifts, your system is just focusing all its resources on reproductive health right now. It's temporary, and most women find their energy bounces right back as soon as the stimulation phase is done.
Question 3. How many months does the entire process take? Mental planning is huge for feeling in control. Couples always want to map out the overarching timeline so they know what to expect.
When you map the whole thing out, the journey usually spans just 2 to 3 months total. One actual IVF cycle is incredibly efficient, taking about 4 to 6 weeks from the start of the meds to the embryo transfer. So that 2 to 3 month window covers everything: your initial screening appointments, the active cycle itself, and finally, the famous 2-week wait for your pregnancy results. And this brilliantly illustrates why trusting the right clinic matters so much. 71%. That is the world-class success rate at ART Fertility Clinics in the UAE. By combining highly personalized protocols with the advanced incubator and safety monitoring tech we just talked about, they provide solutions that adhere to the absolute highest international standards.
Well, we've covered the science, mapped the timeline, and tackled the big questions. Knowledge is absolutely power, especially when it comes to your health and your future family. So my final question to you is this. Are you ready to take that first, fully supported step toward building your family? You've got the roadmap now. Whenever you feel ready, the experts are there to guide you the rest of the way. Thanks so much for joining me on this explainer, and I am wishing you the absolute best on the exciting journey ahead.